Hi, my name is Desiree Griffin, and this is Heather McQueen,
Hi.
and she works for Florida Sports Medicine, and she's a medical assistant, and I'm interested in the medical assistant field, so I'm going to be asking her a few questions to get to know better about the job. What made you want to become a medical assistant, Heather?
I like working with people. My mom's always worked in the healthcare field, and I just kind of followed in her footsteps because it interests me and it's a good way to work with people.
Great. And some medical assistant programs, I've heard that they're 1- and 2-year programs. Which program did you decide to go with?
I did the 1-year program. Majority of it was online. And
Okay, so just 1 year and online. I didn't know that they had online for medical assistants.
they do offer online. I did it through University of St. Augustine. They were offering it online. So
That's excellent.
what I
I had
did.
no idea. And approximately how much was it for you to go to college to become a medical assistant?
It was around $1,000. They were offering discounts to businesses that had employers that were looking to better themselves and everything, so I did it through that, and it was a little around $1,000.
Okay. And in your opinion, how hard was the schooling for you?
For me, I can't say it was really hard. I like the healthcare field, so I like all the classes. They always interested me, so I've always, it was always an interest. I'm not a test taker, so the tests were a little bit harder, but the classes themselves weren't really that hard.
Okay. And were there any on-hand experiences? I mean, I know you said you did it online, but did you ever have to go into class?
I did an anatomy class, and I had to do that. You can't do that one online. Or this one did not allow you to do it online, and that class helped me a lot, more so the lab. Being hands-on and learning about the body and everything. You also have to be able, in some practices based on where you work, you have to give shots.
Did you ever have to give shots when you were in school, or how did you prepare yourself for that?
I did not. I just practiced on my own, and I just prepared myself.
How would you practice it? Did you do it once you got the job? Did you practice in there? Or,
I did, and I would practice at home with a pretend needle, like a syringe or something, and just practice.
Oh, that would be scary. And what is the difference between a front office and a back office medical assistant?
In the front office, you are responsible for all the phone calls, and you have to screen all the phone calls to determine if you need to get a physician right away or if it can go to their voicemail until voicemail can be checked. You are responsible for checking patients in, so when they come to the window and sign in, verify what they're here for, that their insurance is the same, and if you need to collect any co-pays or anything like that at the front. There is check out, where you're responsible for when the patient leaves the office. They come up with their papers of what the doctor ordered, whether it's physical therapy, diagnostic testing, lab work, anything like that, and schedule that for the patient. And if the patient wants to schedule it themselves, you would document that so that you would follow up in an appropriate manner to make sure that they're following doctor's orders, collect any deductibles, co-insurances, schedule their follow-up appointments based on what the doctor's orders were, filing charts back, filing their paperwork appropriately in their charts. In the back office, you are the doctor's shadow, so to speak. You follow the doctor where he needs to go. You call the patients back, put them in their room. You're with the doctor in that room or standing outside the door in case he needs you to prep something. I'm in the sports medicine field, so he did a lot of injections, he would aspirate knees to take fluid off the knees or something, or cortisone injections in the shoulders. So we would prepare him for that. We would prepare the supplies for him, and then he would do the injection.
Okay, and so were you a back office medical assistant, or are you?
Both.
You are both? Okay. And how did you decide which one you wanted to do front or back office, or do you like doing both?
I like doing both. I started out in front office, and when I obtained my certificate, I went to the back office, and I do both. I kind of was the floater, so to speak. I would do front office, and if they needed help in the back, go to the back. So I do both, so it keeps me busy and makes the day go by fast.
So do you need a special certificate to be in the back office?
You just have to have your medical assistant certificate to be in the back office.
Okay, so I wasn't sure if you needed a special certificate
Not
to work
special,
in the back.
just
Excuse me. And once you started working as a medical assistant, what is one thing that you were not prepared for that you did not learn in school?
not prepared for patients and their professionalism towards you, because some patients are going to come in and they know that they have an appointment, and yes, they are in pain, otherwise they wouldn't be at the doctor's office, or they're not feeling well. We have to respect that as a professional, but we also have to accept that they're in pain and deal with how they are responding to us, with their tone of voice towards us, if they choose to walk out of the office, not follow doctor's orders. You have to be prepared for how a patient could treat you, so to speak.
So what role does communication play in the medical assistant field?
Communication is a big role. You have to have the communication or it's not going to work. If you're in the front office and you're, answering phones and you have a phone call and they say that they need a physician or a medical assistant right away, they're having certain symptoms, you have to determine if it can go to voicemail, if you need to take the message down or put them on hold and go get the doctor. Really, if they're just calling saying their medications aren't working, they need a medication refill, they can go to a voicemail. Based on every office is different, but from my experience, if it's something like that, it can go to voicemail and be addressed at the end of the day. Or if a patient calls in and says that they're having knee pain or swelling and it's hot and red down my calf, then we need to go get the physician, because he has to it has to come from a physician to order it. He has to direct the patient to go to an ER or a MRI facility to do an ultrasound to determine if they have a blood clot.
Okay, so do you think communication goes beyond just answering the telephones and dealing
Yes.
with customers? Does it also go like in the back office when you're dealing with the customers when they're irate or not understanding what's going on?
Yes, it goes front and back office. Communication is key. If you don't have that, then
You need to
you're
find another
gonna
career.
fall off. Everything's gonna fall apart.
And what do you like most about the job?
I like that it's fast paced, never a dull moment, front and back office, so it's not doing the same. In a sense, you are doing the same thing each day with your patients, but every patient is different. And if you're in the front and the back, you're getting both experiences. So you're not just sitting all day at a desk or standing all day in the back with patients.
So it's not routine.
Great. You have routine, but it's broken up.
Okay, and what do you like least about the job?
Patients that become irate or upset, it's very hard to deal with patients when you're trying to help them and they want to talk over you, or they feel that they don't need to listen to you.
Or they feel like they're the doctor?
Yes,
Overall, do you like being a medical assistant?
I do. I like it very much. I like helping people and I like working with children. I started at Florida Sports Medicine. I like sports. It was a good atmosphere when I went in there, and I like working with people. So I enjoy it very much.
And what is the entry level pay for a medical assistant on average?
It's going to be based on what type of practice you go to and what they're willing to give you with your experience and your certificate and everything, but between $20 and $25 a year.
Okay, and what is the highest salary that a medical assistant can make?
As far as I know, it'd be about 25.
So 25 would be the max.
As far as I know, yes.
And is the pay what you thought it would be when you originally started training to become a medical assistant?
Yes.
So you
Yes,
knew that.
I knew it wouldn't be high up there. but I wanted to start somewhere.
Well, have you ever considered going for like an RN or a higher degree of?
I have
The medical field?
actually considering going back for occupational therapy assistant and working with pediatrics.
Oh, that's great. And is there any advice that you could give me if I decide to pursue a career as a medical assistant?
If you don't like the sight of blood, be prepared, because you will see blood, and giving shots. It looks easy, but it's not easy. You have to find that spot on the knee or the shoulder and inject it in the appropriate spot.
Oh, wow. And so how would you learn that if you don't actually have the on hands? If you do all your training online, is that basically on the job training?
Yes.
That could be scary.
The way I went to school, yes, I did on-job training, yes, because I did everything online, except for anatomy.
Okay, so then after you graduated from school, did you have to do like an internship before you could get your certificate?
I did, and I did it through my employer. They allowed me to stay where I work to do my internship there.
Okay, so then that's when you got your certificate that you could do
Correct. Correct.
more. Okay, well that's good. I didn't know that a lot of the jobs offer on-the-job training to where you could do that. I thought you had to have your certificate first.
Some employers or some businesses do. You just have to ask. And I had been with this company for some time, and when I talked to them about it, they were fine with it.
And did your job have any like tuition reimbursement to help you with?
They
The
did not
cost?
offer that. No, they did not offer that. Some companies might offer that. This company did not offer that.
So most of the assistance was like financial aid or grants?
It was all financial aid.
All financial aid. Okay, so is there any other advice that you would give anybody that wants to be a medical assistant, or just pretty much be ready to see some blood?
Just if you like people and you like the healthcare field and you like to stay busy and have your routine broken up, you're in the right field. And always consider to better yourself. Once you start there, do something else.
Okay, great. Well, thank you so much, Heather. I really appreciate you answering my questions today.
Thank you.
Bye.